Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. Reopening of the federal government brought a critical, immediate lifeline to the skilled nursing sector, bringing back essential Medicare policies that had abruptly lapsed. The most immediate victory is the restoration of Medicare telehealth waivers, which expired on October 1st. These waivers, crucial for allowing nursing homes to use virtual care for therapy and diagnostics, are back in effect and, more importantly, retroactive, as providers faced immense stress, many forced to hold claims or stop using virtual tech altogether. While policies are technically continuous, providers are anxiously awaiting confirmation from CMS on how to process claims under the restored rules. Without a legislative fix, Medicare providers could have faced a crippling 4% reimbursement cut due to prior tax legislation, the most immediate threat to nursing home care. However, relief is only temporary, as the funding bill only runs through January 30th, setting a new deadline for Congress to address telehealth waivers along with the fate of acute hospital care at home programs. Routine surveys are resuming, and providers like Leading Age are already pressing CMS to finalize the repeal of the controversial minimum staffing standards and provide timely updates to the 5-star QRS. The nursing home industry is back to full operation, but with the January deadline quickly approaching, the fight for sustainable reimbursement and clear regulatory guidance is far from over. In honor of National Family Caregivers Month, the U.S. Department of Health and Human Services launched a new effort aimed at easing the burden on millions of family caregivers. HHS unveiled the Caregiver AI Challenge, a national competition offering $2 million to 10 innovators who develop AI tools that support, educate, and reduce administrative strain for caregivers. Over the next 3 years, the initiative will distribute up to $6 million in total prizes, according to the Administration for Community Living, the division funding the program. The announcement came after emotional testimony from family caregivers, advocacy leaders, and lawmakers, all emphasizing urgent need to strengthen the nation's caregiver infrastructure. 63 million Americans provide unpaid care, often at great physical, emotional, and financial costs. The president of the National Alliance for Caregiving called for a fundamental reorientation of long-term care, arguing that home-based support must become the foundation, not the alternative. Several caregivers shared personal stories, including Kelly Lamb of Little Rock, Arkansas, who became a caregiver at just 23 when her husband was paralyzed. With family support and resources from the Reeve Foundation, her husband went on to become an attorney, while Lamb herself became a marathon runner and raised over $100,000 for paralysis research. A major federal watchdog kicked off a sweeping audit of nursing home reimbursement practices. The OIG announced Pinnacle Multi-Care Nursing and Rehab Center, a Bronx facility, failed to meet Medicare requirements on 99 out of 100 reviewed PDPM claims, leading to $1.1 million in overpayments in 2020 and 2021, and could total more than $31 million. The facility's attorney argues the audit ignored the realities of early COVID crisis, when New York City was one of the hardest-hit regions, and CMS temporarily eased documentation rules. The OIG confirmed it's auditing 3 additional SNFs, and industry leaders warn implications could be massive, spilling over into state-level reimbursement systems relying on PDPM methodology. The OIG says it used data mining and analytics to identify providers at risk, declining to reveal how targets were selected. In Pinnacle's case, investigators pointed to a significant spike in Med Part A payments. Pinnacle, however, says the OIG's clinical reviewers misunderstood the realities of skilled nursing, misapplied Medicare rules, and ignored patient complexity, including age and comorbidities warranting skilled care. The facility's experts, including a certified MDS trainer and nursing home medical director, refuted many of the report's clinical findings. The OIG is recommending Pinnacle repay the $31 million, conduct internal audits, and retrain staff. Pinnacle says it will not comply and is prepared to fight the findings if CMS adopts them. With PDPM implemented just months before the pandemic, providers say they never received the usual early audits and education. Now, the industry is bracing for what could become one of the most consequential reimbursement crackdowns in years. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.